Hi, Dr. Shubha. Thank you for joining me on this and taking out time from your very precious time and taking out time for
Hello.
this and joining me. Welcome to the show. Uh,
Hello. Thank you.
so, the idea behind this is to understand the perspective of all of us and how, even though we are chained and confined to our own homes, how we are united in the way we are dealing with different things every day, no matter who we are. Like you are on the forefront and you see a lot of it, and we are at home. Some of us are at homes, and we get to hear a lot of stories, and there's a lot of angst and anxiety and a lot of thing up in the air. So what we want to get perspectives and how everybody is coping in different ways, and so that we can collectively learn and learn from each other's experiences and take it forward and go through this and wait for the day everything
Yeah.
passes and we are all back to kind of some kind of same place. So tell us about how it's going for you. Like, how are the things at your end? I'm sure it must be pretty hectic, so just want to get your view.
Okay. Of course, we have continued working whole of the last year and this
Mm,
year as well.
mm,
I'm an oncosurgeon.
mm,
So for me, frankly speaking, it was not so hectic.
mm,
But the difficulty which I am facing at the moment is regarding my onco department is that even our diagnosed patients, because of the scare, they are
mm,
not coming and they're delaying their cancer treatment.
mm,
So the curable patients, they are becoming incurable. The early stages are becoming advanced stages.
mm,
So convincing someone to get their treatment started, or to
mm,
convincing people that if you have any symptom, come and show us,
mm,
is it has been really problematic since last 1 year.
mm,
But yeah, for us also there were struggles. We were not directly dealing with patients, but yes, we cannot shut down the hospital as well.
mm,
And apart from that, all relatives, friends, everybody, we hardly sleep the whole night because we keep on getting calls. Either
mm,
somebody is anxious,
mm,
then we have to, counsel them.
mm,
Or if somebody is looking for a bed, then we
mm,
are trying to, locate it.
mm,
So yeah, in those ways it has been hectic. But since I don't directly deal with patients,
mm.
that is not there.
Mm. So how do you, like, I'm sure there's a lot of burnout for doctors, especially who are in the place where they need to give care. No matter what is going through on their mind or their end, they have to give care. They are in a role where they have to look out for people. So how do you manage yourself? Like,
Yes. See, our struggles were, of course, see, everybody struggled in the last 1 year, more than 1 year now. Everybody has their own struggles, right? So, what everybody is struggling. So, for us, the main struggle was how to balance hospital as well as home.
mm,
Because in these times, we were not getting any help. We
mm,
had to go to the hospital as well. So,
yeah,
I've got a toddler at home.
okay.
Daycares were closed, no nannies, nobody at home. So, how to manage?
Mm,
And we live in a nuclear family.
mm,
So, that was the main concern last year, at least, when the
mm,
lockdown had started. So,
mm,
then my parents came to my rescue. For around, I think, 4 5 months, I did not meet my 3-year-old.
mm,
So that was a struggle in a way. Now we are dealing with it. At least
mm,
since last October and September, things had stabilized.
mm,
Now they again worsened this April.
mm,
But yes, self care. To
mm,
deal with anything, self care is on the.
yeah. Yeah, like you said, when there are hardships and hard times like this, everybody may feel overwhelmed and they feel like they are the
Yes.
only ones suffering, but that's not truly the case, because everybody is having their own struggles, own battles
Yes.
to fight, and it's not different for somebody like you. Like, you
Yeah.
have the same kind of conundrums, like how to manage your home with a toddler, the same kind of questions. So how do you manage it? Let's go to the finer details, so that what are your personal ways to manage it, so to say? How do you maintain that
So,
clarity, maintain that
okay.
motivation?
So actually, to manage, so I'll start with just basics. So
Mm.
to manage home and toddler, we have always got help because both of us are doctors, me and
Right.
my husband. So we have got always got help. Thankfully, we do get sometimes 24 hours help. But last year, just
Mm.
before the lockdown started, we did not have any help.
Mm.
It somehow happened that we did not have any 24-hour help, and then lockdown occurred, no daycare. So at that time we were really struggling that
Mm.
we cannot stop going to the hospital come what may.
Mm.
So then we managed, then finally, since the lockdown eased, our help could come back to us. So
Mm.
then we could get our baby back. And see, most of the people, why they were struggling is because they could not go out, they could
Mm.
not socialize, they
Mm.
were, imprisoned in their own homes, kind of.
Mm.
That was not the thing for us. Of course, we were not socializing, but at least since we were going to the hospital, that was not for us. But at the back of the mind, main thing was we could have carried the disease back home.
Mm.
So we were the biggest risk for people at home, and we still
Mm.
are actually.
Mm.
So that risk is always there. So you have to balance everything. That means.
Yeah, that's really amazing, and we cannot thank you guys enough for risking yourselves and your families for us. And I'm sure that people at your family will also be equally concerned. So, but from a
Yeah.
mind perspective, I just want to understand the dichotomy here, or understand the how your minds work. Like, for example, I know you are trained. So, that is that part of the training you get while you become a
It
doctor?
actually it is not, but the hardships which we go through while doing our undergraduation, post
Mm.
graduation, or super specialization, it kind of conditions your mind.
Mm.
There is no specific training which is given to us,
Mm.
but all that hardship does condition you. We are used to working non-stop for 72 hours as well during our
Mm.
PG days,
Mm.
surviving on minimal sleep, no food, no water.
Mm.
So somehow I would say we are conditioned, but at the end of the day, all of us are humans.
Mm.
So what happens to other person is also happening with us. We also get stressed, we also get
Mm.
anxious.
Mm.
Seeing all those news around
Mm.
does affect us
Mm.
also,
Mm.
but we have to take each day as it comes.
So, what are your personal ways to de-stress? Like, what are your go-to ways? Like after a hard day, I'm sure having a toddler is a blessing, so that a little bit
Exactly.
of it is,
Yes.
yeah. So, what are the ways and means you use?
So first of all, just as you said, playing with a toddler only, or most of your 90% of tension is gone.
Okay.
Having a good cup of coffee,
Mm.
relaxing at home.
Mm.
And for me, I relax by reading books, by the way. So just
Okay.
give me a good book and then I'm not concerned much. But
Okay.
yes, whenever you are anxious, it's normal to be sad. It's normal to be anxious whenever
Mm.
you're feeling like.
Mm.
But take it as it comes. It's not that you keep on thinking about sad things only, anxious things only. I know lots of bad things are happening all around the world. It
Mm.
affects everybody,
Mm.
but then we just have to go
Yeah.
on
And
working.
how do you take care of your body, like the physical health, like the working continuous stretches, and your schedules can be really erratic and hectic. So how do you maintain your equilibrium, so to say? How do you take care of
Yes.
yourself?
So, truthfully, the whole last year was not really good in taking care of myself, if
Mm.
I am being truthful here,
Mm.
because we did not have any help at home in anything.
Mm.
Not cleaning, not cooking,
Right.
nothing at all. So, somewhere doing all those things, we were neglecting ourselves.
Right.
But since the starting of this year,
Mm.
I tried to amend that and I
Mm.
started self care. So, all those uh, 30 minutes of physical activity, self
Mm.
care, whatever did not happen the last whole year has
Mm.
now again started since this year.
Mm.
And what I started since last year, I won't say the whole of last year, I started from around November, December,
Mm.
was journaling, gratitude
Mm.
journaling.
Mm.
So, somewhere that did help, and thankfully, till now, I have continued.
Mm.
So, it does help in keeping all your anxiety away.
mm,
So hopefully I'll continue it. So that was something which I did for my mental health, because somewhere you are getting affected by
mm,
all that sad news all around.
mm, mm,
uh, Lots of the times it such happens that many news does not come, like
mm,
the mortality rate, death rates,
mm,
what is being
mm,
shown
mm,
is a fraction of what is happening, which we know.
mm,
So we are the ones, the healthcare workers are the ones who are the most scared people, because we do know what is happening. Maybe people, they get scared by seeing news. I
mm,
usually don't watch news, by the way,
mm,
because all those channels are just showing those things.
mm,
So but we do know what is happening, so that was really scary. So I
mm,
needed to do something for myself, so I started gratitude journaling.
mm,
Started, at least since this January, I started regular physical activity, which was missing since last whole year. The
mm,
last whole year was really bad in terms of self care. It was absent. There was nothing at all. We
mm.
were just, surviving day to day, that
True.
finish one day and then go on to another day.
Mm.
Actually, still we are just surviving only, but with an added dose of self care as well.
Yeah, and absolutely that makes a whole lot of difference, I would suppose, because like you said, you are at the brunt of all of that because we can probably look away, shut down our social media, so stop looking at WhatsApp, and we can probably maintain a little bit of equilibrium and stay away from all that news. But I would suppose there's no way for you to look away because you are there in the field. So there's no way you can
Yeah.
escape the reality of things which are on you in your face, kind of. So so do you write down the gratitudes or like on a daily basis, things that you're grateful
I
for,
do it
etc.?
daily, but instead of doing late at night, I do it early in the morning for the
Mm.
previous day when the whole house is asleep.
Okay.
So I do it early in the morning for the previous day. I don't do it late at night because I am actually an early sleeper and an early riser.
Mm.
So when the whole house is sleeping, at that time I write it down early in the morning.
Yeah.
And
Okay.
one more thing which I started since last 2 3 months was that till now, not only for the pandemic, till now I have never been consistent with my skincare.
Mm.
I would forget to apply sunscreen, no night cream. When I feel like, then I'll apply. Then 4 5 days I won't apply.
Mm.
And during this, we had to wear masks daily,
Mm.
right? So that also started affecting the
Right.
skin. My whole face was full of acne because of that
Mm.
wearing mask,
Mm.
added to no skincare at all.
Right.
So since last 2 3 months, I started doing that. So that was one more thing in self care which was added, and
Mm.
hopefully I'll continue it. So these are the just few things which were like, which I did for self care. Which at this time, actually, first and foremost is your mental health, keep your physical health, and of course any form of self care which you've been ignoring yourself.
Mm. True, because idea of self-care also gives you a kind of you're taking care of whatever is in your
Yes.
control, a little bit of it you're is
Yes.
going towards yourself, probably building you and keeping you in a better shape than yesterday. So it's anything that's worth, that's a little also adds and it's worthwhile, I would suppose. So like the physical, sorry, just a minute, I lost my thought.
No problem.
We're just speaking about journaling, right? So,
Yes.
okay, let's move on. It will come back to me. So whatever, yeah, whatever news that's happening, there's a lot of another information this whole. So that is also
Yes.
adding to like it's becoming a mental issue. Like so most of the
It
doctors
is.
are now saying the probably the treatment itself is something, and treatment the mind and the psyche of patient and the family and everybody else is becoming very difficult. And there's a
Yes.
lot of information that's going on.
Misinformation, actually.
Exactly. So
Misinformation, yes.
there's somebody who says something, something comes out, and somebody else is saying some. It's like the Chinese whispers going
This
on
was, yes.
rounds, and it's really taking a very miserable shape. So, what's your take on that? Like, can we like probably if there is something that happened with somebody and it stayed with the doctor and the patient, it was kind of a private thing, and now everybody knows about everything, and everybody is a doctor on. So it's very,
Google doctors.
yes, Google and WhatsApp universities.
Yes.
So it's
Yes.
very difficult and very damaging to the whole well-being, mental well-being of the society. So is there something we can, any ideas and thoughts about what, where, anything we can kind of curb it a little or somehow? Of course, it's
Yeah.
down to the personal responsibility. We can stop using all
Yeah.
those, but somehow it percolates.
See, when this disease started, this disease was very new, right?
Mm,
So even those doctors, they were treating as and when what was coming.
mm,
So at that time, whatever fake news was going on, people were, just believing it,
mm,
because their healthcare providers also did not have all the answers. It
mm,
was such a new thing that every day the protocols were changing.
mm.
Every day treatment protocols were changing. How
True.
what is reacting, what is not reacting, everything was changing.
Mm,
So at that time, it was really scary at that time for everybody, even the
mm.
healthcare providers also, because
Correct.
even we did not know what is true, what is false. So for
Mm,
now, what I would like to say is, instead of believing all that WhatsApp news
mm.
or Google News or those YouTube news and Instagram news, just go to the specific sites. There are government sites, there are national, international sources which give you right information. So if a forward comes to you on WhatsApp, like recently there was a forward going on that when you're menstruating, when you're having your periods, don't get a
You
vaccine.
cannot vaccine. Mm,
Yeah. And my God, that was the viral message, and everybody was sending it,
mm,
which was completely false, right?
mm,
So, if something like that comes to you, instead of believing it, go to genuine sites. There are multiple national, international sites, and just verify your news. So,
mm,
just don't believe it. Just don't believe whatever you are hearing or whatever
mm,
you are seeing. Research for yourself. Okay, you don't want to dedicate so much of time researching,
mm.
right? Everybody does not have the time.
True.
So go to genuine sources and get it cleared.
Mm,
Like, everybody is in contact with their family physicians, their family
mm,
doctors,
mm,
or people who are in research or somebody. So get it confirmed by a genuine source, and just don't believe in all these false news, and don't try to believe whatever you read on WhatsApp, please. And
mm,
this is not only for this, it is not for that. With this WhatsApp and Google News, we have been struggling since years, since advent of social media.
mm,
So, and especially in my field, breast cancer, oh my God, there are so many false or misinformation doing the rounds, that not only now, we have been always struggling since last few years when the social media has been so active.
mm.
Because earlier, when social media was not so active, one false information spreading would take time, it would take days, it would take years.
Right.
Now it doesn't even take minutes.
Mm,
So now, what you are reading, what you are saying, just please confirm it from a genuine source, and don't
mm.
believe anyone.
Yeah, that's true because it only adds to your anxiety. So,
Yes.
as less information you consume and keep up your own self care and stick to your routines, and it's always best to. Sometimes it's like we're going back away from this knowledge is power kind of an adage to back to ignorance is bliss. So
Yeah.
probably unless you need something really you need to
Be ignorant. That's good.
yeah, for now at least that maintain a stance that ignorance is bliss and probably it's good
Yeah.
for your mental sanity for sure. So
Yeah. In these times, mental sanity is our priority. So don't let anybody or anything interfere with that. If
mm,
you're mentally stable, this will go on. So,
mm. So anything, any other tips and tricks that you want to incorporate in your life for your own well-being to maintain, because you're precious for the society. We are all, but
thank
you
you.
have an
All of
extra.
us are precious,
We are
actually.
all in
Yeah.
our own ways, and this is
Yeah.
actually this conversations that I'm bringing about is a way to contribute in a little way towards the rest of us. Yeah. So, what are the things that you can? I think you sure can level up your self care game, Shubha. In this
Yes.
case.
Yes, exactly. See,
Yeah.
most of the time, all of us, irrespective of the gender, I'm
True.
not saying only ladies,
Hmm.
all of us, we tend to ignore ourselves first.
Hmm.
Something will happen, we are confined at home or something. First thing we do is we start ignoring ourselves.
Hmm.
Okay, our priority becomes, we have to cook food, we
Okay.
have to clean the house, we have to look after this, but we stop looking after ourselves, which most of us did last year.
Hmm.
But now this has been continuing for a very long time, so now we need to step up our game and start thinking about ourselves first. Now is the time to be selfish.
Hmm.
Earlier in schools, we were taught that
Hmm.
selfishness is bad, this is
Hmm.
bad, first you think about others. But now, self help.
Yeah.
So
Yeah.
first you become selfish. Yeah.
It's
So
also
now
now
also,
now it has also taught us it's individual's responsibility that also pans out collectively. So if you are taking care of yourself, staying
yes,
hygienic and doing all that you need to do, then probably everybody else,
you're
everything,
contributing. Yes.
yes, and you're contributing. Sorry, you were
Yeah.
saying something else?
No, no, no.
Okay.
So yeah, start investing in yourself,
Mm,
and take day by day, stop listening to all those negative news. That is the main thing which leads to stress and anxiety. So most of the people who are stressed are the ones who are either on WhatsApp news or on television. They are like stuck to that news. They are the people who are most anxious. Stay
mm,
away from all negative news. Of course, we should be informed about what is happening all around us, what is
mm,
happening in our city, what is happening in our country, what is happening internationally.
mm,
But that does not mean that we let all that negative news consume us.
mm.
So no, stay away from negative news. You should be informed, but don't get into that trap. No.
Yeah. Okay. That's pretty much I had to chat, Shubha. Thank you so much for taking out time for this, and thank you so
Thank
much.
you. It was a pleasure
Yeah.
talking to you,
Thank
Madhu.
thank you
Yeah.
for all the great work you guys do. Thanks so.
Thank you.